Next, I invite Dr. Panku Baghla for a poster presentation on heart-shaped conjunctival cyst.
Good morning, everyone. Today I'll be presenting on topic heart-shaped conjunctival cyst. So conjunctival cyst is a thin sac which is filled with fluid found either on or under the conjunctiva, and they represent approximately 80% of all the cystic growths of the conjunctiva and has a potential to develop in multiple locations: eyelid, conjunctiva and anterior segment, and they may further classified as primary or secondary cysts. The secondary cysts are more common than the primary cysts. Primary cysts are usually congenital and typically remain hidden in the fornix, gradually increasing in size with age. So the aim of our case was to report a case of a giant conjunctival inclusion cyst which was idiopathic in nature, the excision of which led to a large conjunctival defect for which amniotic membrane transplantation was further done. So a 68-year-old male presented to us with a complaint of diminution of vision and foreign body sensation in the left eye for past 1 year. He also noticed a small mass in the left eye which was painless and has gradually increased in size over a period of 1 year. He also had a history of cataract surgery with IOL implantation in both the eyes 4 years back, and patient denied any history of trauma. His best corrected visual acuity in the right eye was 6 and 6.6 and in the left eye was 6.18. On slit lamp examination, both the eyes were pseudophakic. The left eye showed a solitary giant dumbbell-shaped lesion measuring 15 into 15 mm located in the supranasal quadrant of the conjunctiva. This was the lesion which was seen on the evaluation. On inspection, the cyst appeared pedunculated. On palpation, it was found to be white-based and immobile due to its firm underlying adhesions. The trans-elimination was positive. Rest of the examination was unremarkable. The B-scan was also done to rule out the deeper interocular extension of the cyst. On histopathological examination, the cyst was lined by non-keratinized conjunctival epithelium, and as we can see, there are presence of the apocrine nodes also. So further, the patient underwent meticulous surgical repair of the cyst under local anesthesia. The conjunctiva around the cyst was separated by blunt dissection. The cyst was firmly adherent to the underlying sclera, so it was just excised in toto without rupturing the cyst wall. The resultant bare sclera defect was about 16 into 19 mm. So since there was a large defect, the amniotic membrane was procured and processed and used to cover the defect. So diagnosis of conjunctival inclusion cyst was made, and patient was post-operatively started on antibiotic and steroid eye drops for a period of 1 month, and over a 1-year follow-up the defect healed well and no local reoccurrence was seen. Post-operatively the patient's symptoms were relieved and his best corrected visual acuity improved to 6.6. Amniotic membrane was found to be in situ and was adequately covering the defects. So to conclude, this case signifies the importance of a timely cyst excision with amniotic membrane grafting, wherein the primary closure is not possible, which yields good outcome. Preserving vision and averting a reoccurrence is a mainstay of treatment, which was achieved in case by en masse removal of the cyst with the amniotic membrane transplantations. Thank you. These were my references.
What is the cause for inclusion cyst?
Ma'am, in our case, it was kept as idiopathic, but the other causes can be any history of trauma or any history of a
Your patient did not have trauma?
No, ma'am.
So in your case, what could be the cause for it?
Ma'am, at first we thought it could be likely due to the cataract surgery which happened 4 years back. It could be a likely cause, but in our case it was ruled out that since it was a very uncommon site, the cyst was found in a supranasal quadrant, and the cataract excision was 4 years back, and the patient only started experiencing this soft mass growth 1 year back. So we ruled out SICS also, and it was kept as a primary cyst.
Okay, as a primary cyst.
Right now.
So would you excise all conjunctival cysts or would you be selective?
Ma'am, we usually prefer if the patient is symptomatic and the patient is that the cyst is gradually increasing in size and it's obscuring the visual axis, so we mainly go for that patient for excision. Thank you.